Hello and namaskar everyone. I'm Divya, your host, and welcome to today's live session. Thank you for joining our live session. In today's live, we are going to explore about excessive sweating. We can also call it hyperhidrosis. And we are going to provide information on that with our expert, Dr. Lata. We are live on different social platforms, Facebook, Twitter, LinkedIn, YouTube. So hop on your favorite social media and let us know your questions in the comment box. For today's session, we have our expert, Dr. Lata Rijhwani. She has done post-graduation in pediatrics from Udaipur and postgraduate diploma in dermatology from Cardiff University. She has also worked under Ministry of Health, Kuwait, and currently practicing in Jaipur. Welcome, ma'am, to today's live. It's great to meet you virtually. How are you doing today?
I'm very good, Divya. Thank you for having me once again. It's always a pleasure to be on this platform.
Thank you, Dr. Lata. It's always a pleasure to have you in our live sessions because you always bring so much of information to our audience. So, Dr. Lata, should we dive into the session?
Yeah, definitely.
Okay. So, as we will be exploring about the excessive sweating, so my first question is like, what is hyperhidrosis?
Yeah. Divya, as you and everybody must be knowing that we all sweat, and sweating is an important and integral part of the thermoregulation, and we all need to sweat for our thermoregulation. But hyperhidrosis is a condition in which you are sweating excessively more than normal and without any trigger. So normally we sweat when we are exposed to heat, or we are nervous, under stress, we are exercising. So if any of the triggers is missing and still you find yourself sweating and you are sitting and you can see sweat on your body, that is when we label it as hyperhidrosis, to be precise. Yeah.
Okay, that's wonderful. So, as you explained what is hyperhidrosis, so I wanted to ask, like, is there any types of hydrosis? If there is, what are the types of it?
See, hyperhidrosis, broadly we can divide into two parts. One is the primary hyperhidrosis, which is the most common type, and which is why the patients are mostly coming to us dermatologists. And the other is secondary hyperhidrosis. So as the name suggests, the secondary hyperhidrosis is secondary to an underlying medical condition. So either the patient can be having thyroid dysfunction, can be having diabetes, can be obese. In females, they can be experiencing hot flushes as their menopausal period. And sometimes head injury or head trauma can also lead to excessive sweating. Sometimes certain medications can lead to excessive sweating. So if some underlying cause is there, we label it as secondary. But most of the patients who come to us who are concerned about the sweating, they come under the category of primary hyperhidrosis, where there is no definite cause. And medically, these people are fit and fine. Mostly the teenagers and young adults, they come into this category. And most of the times, their sweating is localized. It is called primary focal hyperhidrosis. Like the patient can be complaining of like that I have more sweat on my scalp or face, for example. Sometimes the sweating is only restricted to palms and soles, or only in the armpit region. So this category is the most common, and those are the patients who we see most commonly in our OPD. And this is the types as you asked. Yeah.
Okay, so that means in secondary hyperhidrosis, if someone is facing like thyroid or different
Yeah.
conditions, okay, that lead to
Yeah.
hyperhidrosis. That's great to know. Okay, so before moving to our next question, viewers, if you're just joining our session, we are exploring about excessive sweating with our expert, Dr. Lata Rijhwani, and we are live on Facebook, Twitter, LinkedIn, YouTube. So hop on your favorite social media and let us know your doubts in comment section. So let's back to our topic. So Dr. Lata, like you mentioned, you explained about the hyperhidrosis and what are the types. So, like, what is the main cause of this hyperhidrosis?
Yeah, as part of my question is answered, I have answered previously, but coming to the primary hyperhidrosis, mostly it has a genetic component. Like most of the times, the patient, as I said, they are medically fit, and when we evaluate them, there is no associated medical condition, but so it has more of a genetic component, and in almost 25 to 50% of the patients, you can surprisingly find a family history. Like when you ask them, वो बोलेंगे कि हाँ हमारे घर में either their parents or any of the other relatives will be suffering. So it has got a genetic component, the primary hyperhidrosis. And basically what happens is that the sweat glands in such people, they are normal. They are normal in distribution, normal in number. It's nothing that their sweat glands have a problem. The only thing is the sweat glands are hyperstimulated. So the problem is in their the nervous system. The autonomic nervous system is faulty, and the sweat glands, which are normal, are hyperstimulated. So
Okay.
this is how they sweat more profusely than others.
Okay, so that means there are different causes, like different conditions or genetic.
Yeah.
That's great to know. So, Dr. Lata, like we discussed about causes also. So, what are the complications of hyperhidrosis if someone is facing this excessive sweating?
Yeah, Divya, it seems a very simple problem, like people are sweating excessively, but believe me, it has got some physical problems, of course, but more than physical, it affects the patient psychologically. Like so much so that people are so embarrassed, especially the teenagers and young adults. They are socially cut off and they don't want to participate in sports, they don't want to go to the parties, and not only that, students while studying, like some of them, they can't even write, literally their hands are dripping of sweat. So psychologically the patients, they become very, and I think still the awareness is very less. Like लोग चलते जाते हैं कि ठीक है, ठीक हो जाएगा जब बड़े होंगे. No, you don't outgrow this condition, you have to treat it. Like hyperhidrosis, the primary one I'm talking about, it's not that कि आप बड़े हो जाओगे तो sweating will suddenly disappear. No, you don't. You have to come to an expert, you have to get evaluated, get some tests done, and treat it right then, because then by the time they come to us, they are so disturbed, they don't want to talk about it even, and they are so disheartened. So this is about the psychological implications. But physically, if you ask me, see, when you sweat more, your skin becomes macerated. It becomes very, it loses its firmness, and it has got many breaches. So when your skin is having breaches, you are always more prone to infections, bacterial, fungal, viral. Like you will be seeing patients who are coming with fungal infections in their feet. They are more prone to warts and bad odors. Sometimes they are more embarrassed because of the odor, and again odor is a result of secondary bacterial infection. So once you are sweating more, many different type of infections you are more prone to.
Okay, so बहुत ही
Yeah.
अच्छे से आपने explain किया, because if we are facing like excessive sweating, तो हमें और भी infection या bacterial infection होने के ज़्यादा chances है.
हाँ जी.
That's great. That's great. So before moving to our next question, let me tell you to all the viewers that eGlobal Doctors is providing different diet plans for you, जो कि reverse करेगा आपकी health conditions like diabetes, PCOS, thyroid, weight loss or weight gain, and many more. So 3 weeks and 3 months plans are available. Visit eglobaldoctors.com for more details. So Dr. Lata, we discussed about the causes, what are the complications, and what are the types. So, like, what are the treatments for it?
Yes. Divya, if we talk about the treatment, broadly we'll divide them into three. One is the topical, that is you apply them on the surface of the skin and it will give you temporary relief, and the other categories being the oral medications. And the third one is we can do some procedures, or there are some surgeries that can be done.
Lata, you mentioned about like there are 3 types of treatments. Like one is to
Yeah,
apply the
broadly.
lotion, and second is oral, and third one is surgery, right? So like अगर surgery का सवाल है तो like normal human condition है, हम surgery सुन के सोचते हैं पक्का कुछ like कुछ ना कुछ disadvantage होगा इसका. So is there any disadvantage if we go for the surgery for this
सर्जरी
problem?
इज द लास्ट ऑप्शन. मोस्ट ऑफ द टाइम्स जो हमारा एक्सपीरियंस है डे टू डे लाइफ में, जो फर्स्ट थेरेपी जो टॉपिकल वाला जो है, मोस्ट ऑफ द टाइम्स काफी हद तक रिलीफ दे देता है. बिफोर गोइंग टू सर्जरी, सर्जरी वी गो इन एक्सट्रीम केसेस, उससे पहले हमारे पास बहुत अच्छे प्रोसीजर्स हैं. वन ऑफ देम इज आयंटोफोरेसिस, स्पेशली पाम्स और सोल्स में. आयंटोफोरेसिस के बारे में मैं थोड़ा सा बताना चाहूंगी, जस्ट टू मेक एवरीवन अवेयर. बहुत सिंपल प्रोसीजर है. ऑफिस में, इन ऑफिस भी कर सकते हैं, घर पे भी जो है ये किया जा सकता है. आपके हाथ और पाँव को पानी के अंदर डिप किया जाता है, एक टब लेकर पानी में, और एक माइल्ड इलेक्ट्रिक करंट हम लोग पास करवाते हैं जो इस डिवाइस के थ्रू. तो उस जो करंट पास होता है उससे आपका स्वेट ग्लैंड जो है इनएक्टिव हो जाता है. इनिशियली वीक में 1 या 2 बार 15 से 20 मिनट इस थेरेपी में लगते हैं, और जैसे जैसे आपको इम्प्रूवमेंट होता है तो हफ्ते में 1 बार या महीने में 1-2 बार करने से भी पेशेंट को बहुत रिलीफ मिलता है. उसके अलावा बोटॉक्स जो है वो फेस स्कैल्प पे उसके रिजल्ट्स अच्छे, इवन एक्सिलरी में टू सम एक्सटेंट. मीरा ड्राई की अगर मैं बात करूं, बहुत ही अच्छा प्रोसीजर ये है एक्सिलरी स्वेटिंग के लिए, और बहुत अच्छे इसके रिजल्ट्स हैं. लिटरली पेनलेस है, और इट हैज गॉट वेरी प्रॉमिसिंग रिजल्ट्स. तो जो सिंपैथेटिक टमी है उस तक आने की नौबत नहीं आती. बट हाँ, क्योंकि ये इन्वेजिव है, तो जैसा कि आपने कॉम्प्लिकेशन पूछे, तो एक तो ये बहुत पेनफुल है, एनेस्थीसिया के अंडर में होता है, स्कारिंग होने के चांसेस ज्यादा है. तो मैं तो यही कहूंगी कि उससे पहले देर आर मेनी गुड ऑप्शंस टू बी ट्राइड एंड दे वर्क वेल. या
Okay, so we should always go to the first easy treatments.
this is ladder, the therapeutic ladder which we call stepwise approach. We can step up the procedure. Yeah.
That's great to know, Dr. Lata. So, Dr. Lata, if someone is having excessive sweating, like
Yeah.
normal person, like in summers we always used to have. So, is it related to hyperhidrosis or is it normal?
Yeah, and this is a very good question. See, before labeling hyperhidrosis, there are some criteria. कुछ लोगों को दूसरों से ज्यादा पसीना आता है, so it all depends कि आपका what is your body type. ओबीज लोगों को पसीना थोड़ा ज्यादा आता है. देन सम काइंड ऑफ फूड कभी कभी प्रेसिपिटेट करता है, सम स्पाइसी फूड्स, कैफिनेटेड बेवरेजेस, दे ऑल्सो ट्रिगर, बट कब हम उसको लेबल करेंगे कि ये एबनॉर्मल है और अब हमें डॉक्टर के पास जाके उसके लिए ट्रीटमेंट लेना है? तो वन इज दैट यू आर वेकिंग अप फ्रॉम स्लीप एंड यू आर स्वेटिंग. कुछ गर्मी नहीं है, देर इज नो हॉट एंड ह्यूमिड क्लाइमेट, you are not going to face any exam, you are not exercising, जिम नहीं गए हैं, बैठे बैठे आपको पसीना आ रहा है, एंड इतना ज्यादा आ रहा है कि इट इज हैम्परिंग योर डे टू डे एक्टिविटी. स्टूडेंट हैं तो लिख नहीं पा रहे, पूरी कॉपी गीली हो रही है, आप किसी से हैंडशेक कर रहे हैं तो उनका हाथ गीला हो रहा है. और ऐसा नहीं है कि ये रोज होगा, बट एटलीस्ट वंस और ट्वाइस अ वीक ऑल्सो, इवन इफ यू आर एक्सपीरियंसिंग सच एपिसोड्स, एकदम बैठे बैठे आपको पसीना आ गया, उठते ही आ गया, दैट मीन्स देयर इज, नाउ यू कैन लेबल दैट दिस इज समथिंग विच इज एबनॉर्मल. ये नॉर्मल से अलग स्वेटिंग है जो विदाउट एनी स्टिमुलस हो रही है. बेसिकली देयर इज नो ट्रिगर एंड यू आर स्वेटिंग. एंड ऑफ कोर्स आपको जो सेकेंडरी हाइपरहाइड्रोसिस है उसके लिए भी पेशेंट को एवेलुएट करते हैं. जब भी पेशेंट आता है तो वी अंडरगो सम मेडिकल टेस्ट्स, एक बार फिजिशियन रेफरेंस भी करते हैं. इफ एवरीथिंग इज नॉर्मल, देन एंड देन ओनली वी आर लेबलिंग देम एज प्राइमरी हाइपरहाइड्रोसिस.
Yeah, thank you so much, Dr. Lata, for providing this wonderful information. So I was about to ask, like, when to see a doctor if someone has hyperhidrosis, but you already answered that. So let's move to our next question. So, I wanted to ask, like, who is more likely to develop this hyperhidrosis? Like, what age group are most affected with this?
Yeah, see, the primary focal hyperhidrosis, mostly young people will come, like school के बच्चे आएंगे, teenagers, young adults, because it has a genetic and familial component, so they will present at an earlier age. तो they have got more tendency, जिनको पहले से family history है, और दूसरे लोग जिनको कोई मेडिकल कंडीशन है, जैसे डायबिटिक है, दे आर मोर प्रोन. और जो थायराइड, हाइपरथायराइड पेशेंट्स में स्वेटिंग इज वेरी कॉमन. अगेन, मेनोपॉजल वुमेन, कुछ मेडिकेशंस की अगर मैं बात करूं तो सर्टेन कैटेगरी ऑफ मेडिकेशन, स्पेशली एंटी साइकोटिक्स, एंटी थायराइड ड्रग्स, जो लोग डायबिटीज की दवाइयां लेते हैं उनमें भी कुछ दवाइयां ऐसी होती हैं जिससे स्वेटिंग ज्यादा होगी। तो वी हैव टू हैव कंप्लीट इवैल्यूएशन दैट कुछ ऐसी चीज जो उनके उसको ट्रिगर कर रही है, इन केस इट्स अ सेकेंडरी हाइपरहाइड्रोसिस। ठीक है।
Okay, that's great to know. So before moving to our next question, viewers, we are providing different diet consultations. Like we have different variety of categories: detox program, weight loss, child nutrition, gut health, and menopause nutrition support. So register with us today at www.eglobalDoctors.com and book your appointment to get a proper nutrition coaching. So, Dr. Lata, my last question is like we in Indian community, we all know that we always try to use the home remedy first, right? So before going to a doctor. So is there any home remedy for hyperhidrosis?
Yes, Divya, it's a time tested home remedy. This is the same thing which we are prescribing. Basically, फिटकरी जो होती है, फिटकरी is nothing but it is alum. It's aluminium salt. जो पहले से हमारी दादी नानी के जमाने से they have been using it and scientifically works the same way जो मैंने आपको बताया. फिटकरी जो है एल्यूमिनियम प्रेपरेशन है और उसका एक चुटकी भर अगर आप एक बड़े टब पानी में अगर आप अपने हाथ या पांव डिप करते हैं तो वो उसी तरीके से हेल्प करती है जैसे कि हमारे ओवर द काउंटर एंटीपर्स्पिरेंट्स जो हैं वो काम करते हैं. तो इट मे टेम्परेरीली हेल्प और कई बार रेगुलर यूज से काफी हद तक जिनमें माइल्ड है, इसमें भी कैटेगरीज हैं. हाइपरहाइड्रोसिस माइल्ड है, बहुत कम टाइम के लिए है और तो उसमें फायदा हो जाता है अनटिल आप डॉक्टर के पास जाएं या आपका कंडीशन सिवियर हो. तो फिटकरी इज वन होम रेमेडी दैट हैज अ साइंटिफिक बेसिस और वो काम करती है. फिटकरी इज
Okay.
बेसिकली एलम सॉल्ट. या
Thank you, Dr. Lata. Like you are providing so much information on what needs to be done to manage our excessive sweating. So before moving further, let me tell you to all the viewers, eGlobal Doctors लाया है आपके लिए new feature. So eGlobal Doctors Digital Health Hospital is coming up with a new feature called eGlobal Ayush. This project is for Indian folks working in USA, UK, Australia, Europe. Do you worry about parents back in India? eGlobal Ayush packages will help provide medical service needs for NRI parents in India. For more information, make sure to visit eGlobalDoctors.com. So, Dr. Lata, before ending this session, uh, can you summarize what we have discussed about hyperhidrosis to our audience?
Yes. See, first, to put it briefly, you have to just find out when the condition is more than normal, like it is worsening and you need to go to the doctor and you really need treatment. You can't just ignore it thinking that ठीक हो जाएगा, because there is no way कि वो अपने आप ठीक हो जाएगा. So take help, take treatment, don't suffer. The quality of life of such people is really very bad, especially the students. So just seek help, immediately, or just don't postpone it. And once the doctor has worked up about what is the kind of hyperhidrosis, what kinds of treatment, discuss with your doctor. They will of course discuss with you the treatments available, and whatever treatment is then suitable for you, you will definitely have excellent results and there's no need to suffer from this condition.
Thank you, Dr. Lata. It's a pleasure to have you on our live session. I think we have got so much knowledge and information from you about the topic.
Hopefully, yeah.
So,
Thank you.
yeah. Viewers, eGlobal Doctor is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात ये है, you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. We have experienced top class doctors at our platform like Lata Rijhwani. They're always here to help you at any time. So thank you, Dr. Lata. And viewers, viewers watching us on different platforms, do comment below on what session you would like to see from our experts. Dr. Lata, for providing such useful information about the hyperhidrosis. Thank you so much. All the
Yeah.
viewers, if you need any help or guidance, you can connect to our Dr. Lata on eglobaldoctors.com. So thank you
Sure.
everyone for joining the session.